Hi, this is Harshada Rajadhyaksha from Prakriti Sports Science and Physiotherapy Clinic, and in today's video I'm going to talk to you a little bit about spinal health. Your spine or your vertebral column is literally the backbone of your musculo-skeletal health. And whether your spine or vertebral column is healthy or not will decide whether it empowers you or debilitates you completely. And whereas this is a really huge topic, what I'm going to do today is just teach you a few simple exercises to maintain the natural or normal mobility of your spine. These are the 4 movements: flexion or forward bending, extension or backward bending, lateral flexion or side bending, and rotations. Out of these, the forward bending has the largest range compared to all the others, and it is also functionally most important. By this I mean you can probably get by in day-to-day life without much rotation, without much sideward bending, and definitely without much backward bending. But without any forward bending, yes, life becomes very difficult. Unfortunately, when you do develop back pain, this is the very same movement, the forward bending, that doctors will tell you to avoid. But that's a whole new different topic. I might tackle it in another video. It's not for today's discussion. Your vertebral column is made up of 33 vertebrae or different bodies of vertebral bodies, all stacked up one on top of the other. In between each adjacent vertebrae, there is an intervertebral disc. Now, though the total movement of the vertebral column or your backbone looks large, between each 2 adjacent vertebrae, the movement is very small. It is the cumulative movement of the whole vertebral column that is significant. It is important to maintain the intervertebral mobility in each segment as far as possible, and by that I mean the movement between each consecutive vertebrae. And that is because when you conduct your day-to-day activities, what you need for your daily life, if one segment is not moving very well, then the one directly above it or below it will naturally have to open up a little more to allow that movement. This might eventually lead to acute or overuse injuries for your back. And so today what I'm going to do is teach you 4 simple exercises that will help you to maintain the mobility of your spine, the health of your intervertebral discs, and also the flexibility of the ligaments and muscles that are attached to your vertebrae. Please do not do these exercises if you already have some pre-existing back condition, if you have back pain already. Please go meet a spine specialist, or maybe you can come and see me before you start an exercise program. We will start with spinal flexion and extension. Stand comfortably with your feet about hip distance apart and your arms relaxed. We will start with a small chin tuck, just pulling your chin slightly back. And then just imagine that you are bending forward each vertebra one at a time, starting from your cervical spine or your neck, and then going all the way down very slowly up to your lumbar spine or your low back. Just think about rolling a carpet, each vertebra bending down one after the other till you reach all the way down, and then relax your back completely, relax your arms, let the gravity assist you, and then slowly start coming upwards. Now you're going to start with your lumbar vertebrae. Those will straighten up first, your low back will straighten up first, one by one, each vertebra. Now you're opening up that carpet. Slowly come up to your thoracic spine or your upper back, and then all the way to your cervical spine or your neck. Straighten one vertebra after another. Straighten your head. Stretch your arms back the way you see me doing, and open up your back completely Open up your chest. And this is a backward bend or extension. Come back to your neutral position and relax. You can do this twice. We are now going to do standing side bends or side flexion. Stand in the same way, feet hip distance apart, arms relaxed, and slowly start lowering your right hand towards your right knee, bending sidewards. Your left hand is completely relaxed. Slowly straighten up and do the same movement to the other side. Straighten up and relax. You can repeat this once more again. We will now do a seated rotation. We prefer to do this in a sitting position so that the pelvis is fixed on the chair and there is least amount of torsion in your spine. You can hook one arm behind the chair as you see me doing. Place your right hand on your left thigh or your left knee and kind of use the hand to pull yourself into full rotation. Gently, not too fast. Return to the neutral position and then do the same on the other side. Hook your right arm behind the chair, left hand on your right thigh and twist towards the right. Straighten up to neutral, relax. Again, you can do 2 repetitions of this. We are going to stretch in standing. It's a long stretch. Just stretching all the muscles that surround your spine and allowing the vertebrae to stretch away from each other. Stand again with your arms relaxed, feet hip distance apart. Raise your hands up towards the ceiling or the sky. Stretch both arms straight up without arching your back, straight up towards the ceiling. You'll feel the muscles around the sides and at the back stretching. Hold this position for a few counts and slowly release. Repeat this again once more, 2 repetitions. Take a break from your work 2 or 3 times a day to do these simple exercises which will keep your spine flexible and healthy. And do not forget my earlier words of caution. If you have any pre-existing back condition or back pain right now, do not do these exercises before consulting a specialist. Like I always say, if you like this video, please give it a thumbs up. Subscribe to my YouTube channel and please share it with your friends and family. Follow us on Facebook and Instagram. See you soon. Bye for now. Stay safe.